While we continue to learn more about Canada's first presumptive case of the coronavirus, and here's what we know so far about the Toronto patient. Now he is a man in his 50s whose name has not yet been released, but he did travel from Wuhan, China to Toronto by way of Guangzhou. He landed in Canada on Wednesday aboard China's Southern Airlines flight CZ311. Lab results to confirm the case are expected in the next 24 hours. Well, the first presumed case in Canada is underlining some of the weaknesses in the system, and earlier I did speak with Dr. Peter Lynn, our CBC News medical contributor, and he pointed out what has and what has not worked so far. So there's a couple of situations where this is the ideal case. So at the port where they're getting onto the plane, they should have been screened already. So in other words, if they're ill, they shouldn't have been on the plane. Now obviously if I was stuck there or you were stuck there, I would just tell nobody, I just want to get on a plane, get home. So therefore that failed. The person's now on the flight is now kind of sick on the plane, but obviously the stewardess didn't notice, because otherwise they would have flagged them at that point. So that failed. And then now coming off of the plane, there's a screening kind of questionnaire. There's like a poster that says if you're ill please report, and so that should have been picked up at the terminal side, and that failed. So in other words, the person went on. Having said that, thankfully the portion after that was quite simple. It was just his family and a private car that he was exposed to, so he didn't go into a subway or anything like that. And the fact that he got quite ill the next day and then used 911 to come in from that point forward, it was quite good. In other words, the protocols kicked in, the EMS people knew what to do, the hospitals were on alert, so at least that portion of it was good. So there's at least a few places where we have to kind of tighten things up, otherwise we are gonna get more and more cases of people ending up at home and then relying on the person to contact the healthcare system. We heard from the officials they are looking for people within a 2-meter radius of the plane, but is that enough given the fact that they shared the flight number? We're talking about CZ311, so this is South China Airlines that landed in Toronto on Wednesday. Why just limit to that 2-meter radius, not just contact everybody on that plane? Yeah, and that's a good point, because what they're thinking is that when I sneeze, these water droplets that carry the virus is sort of gonna drop out at around 3-4 feet, and so that's why they've got this 2-meter radius. But if you think about it, I sneeze, it goes onto the chair, and then somebody walking to the bathroom touches the top of the chair, they've got it on their hand now, and now I've transmitted it elsewhere. So I think they're thinking more like, in a perfect world I sneeze and I'm just sitting there, nobody touches anything. But I think in a practical sense, I think the whole plane should be alerted, and so that's why this is the first time that we've heard the flight number, and I would be nice to be able to know the seat number, then that way the people immediately around there could contact. So right now they're doing contact tracing, which may be difficult. They land in Toronto and they get on another flight to go to Kelowna, for example, so now we might be having some difficulty, whereas if it had a central spot where people can call in that was on that flight, it would just make finding these people a whole lot easier.